Hello, and welcome everyone to this week's COVID-19 update. Thank you for joining us. With me today, we have Spectrum Health Lakeland President, Dr. Loren Hamel, and Berrien County Health Department Medical Director, Dr. Rex Cabaltica. It's been a few weeks since we were last together. Dr. Cabaltica, can you share with us more about the current data trends we're seeing in Berrien County?
Sure. Thanks for inviting me to join this update. COVID-19 always surprises us, and this one is no exception. Instead of trending downwards as previous surges have done after 2 months, we're actually seeing cases continue to rise kind of at a baseline level. So, for example, we averaged more than 58 cases per day over the past 7 days, which is actually a slight increase of about 8 cases from the previous week, 46 cases per day. So it's still kind of middling right now at a basal level. Now we're doing our best to keep up with case investigations and contact tracing, and I know everyone's tired of answering those phones and probably fed up with COVID-19, but we would ask you that if we do call you, that it is to try to help the community. So please do help us with that as much as you are able. Number of cases, again, has been plateauing, so we're trying to find out if there are other reasons why that's going on. So that's part of the reason why answering those phone calls would be helpful. Interesting enough, the greatest increase in COVID-19 cases has been from the 0 to 11 age group, the age group that didn't have the vaccine until a couple of weeks, or actually just this past week, and that's been a 2.3% increase from the week prior. So yeah, it seems that this virus just loves to go to those who are just not protected by the vaccine for other reasons. So because of this, as well as the Berrien County still having a positivity rate of 15.66%, that still means that our county as a whole is still in the high community transmission range as far as the CDC categories. So currently there are in the schools, there are 96 staff from schools and students in isolation, and 580 total in quarantine. Now those are those who have been exposed or in close contact with them, but not necessarily positive at this point. So 96 with 580, that's kind of the situation we're in when we can't do all the mitigation measures that we could do. So some of the mitigation measures haven't changed. Keep wearing your mask as much as possible. Pay attention to hygiene whenever you get a chance. Coming in from outdoors or being out and about, go ahead and wash your hands. Try to keep any gatherings in outdoor spaces as much as possible. And that's going to be challenging with weather getting colder. But as much as you can, try to keep attention to the same measures that we've said before. And again, if you have close contacts have turned positive, then do monitor your symptoms, wear your masks, and there's good guidelines from CDC, Berrien County Health Department's website. If you have any questions, you want to talk to a real person, please feel free to give us a call.
Great. And Dr. Hamel, can you share what we are seeing from Spectrum Health Lakeland in terms of patient census?
Yeah, we expected a few weeks ago to start seeing some decrease in our inpatient COVID volumes. And of course, we've seen an increase, not a decrease. The current census is at 38. We still have significant COVID going on in our ICUs, folks on ventilators. We're still seeing an inpatient mortality that's running about 10%. We're also seeing folks that have been vaccinated, but it's been several months ago, that are coming in with milder symptoms. Some are entering the hospital, still much less likely to get sick, less likely to be hospitalized, and significantly less likely to die. But we are seeing a COVID occurrence in the vaccinated as well. We're also seeing evidence, I'm sure you're at the health department seeing the same, of COVID transmission among the vaccinated. So they're vaccinated, but they're transmitting the viruses to others. And of course, if those others are unvaccinated, they have the full risk of the infection when it comes to hospitalization, ventilator use, and even death. So we certainly encourage folks, it is critically important to continue being very careful with the control measures that have already been described, and be very careful that you don't use vaccination status as a way to be careless about hand hygiene and masking and distancing, because we still are in the middle of a very aggressive pandemic in Berrien County and across Michigan. I would just add that we're seeing even more of that in our Grand Rapids facilities. We have the highest censuses ever driven by inpatient COVID cases. So it is really a critical time within healthcare facilities across Spectrum Health.
Thank you. And Dr. Hamel, there have been quite a few new developments in the past few weeks when it comes to the COVID-19 vaccine, including the approval of the Pfizer vaccine for ages 5 through 11. What should parents know about getting their children vaccinated?
Well, I think it is going to be critical to have everybody vaccinated. We only have to look at the surges going across the country and the surges going on across the world, despite having vaccination rates in adults that are sometimes even in the 70 or 80% range. To stop this transmission, we need everybody vaccinated. That vaccination has been studied in children. Vaccines COVID complications and COVID deaths in every age cohort. So there's no question vaccines in your children outweigh the risk of COVID. So I certainly encourage parents to consider having their children vaccinated.
Thank you. And Dr. Cabaltica, can you share where parents can go to get their children vaccinated?
Yeah, actually, our clinics here were the first to stand up the vaccine. So November 8th was our first vaccination day. You could have actually gotten it as early as last Thursday or Friday. So that first clinic went fairly well. We have another one on the 17th, as well as that's a Wednesday, as well as the 23rd, which is a Tuesday here. And those run from 3 to 6 p.m. to try to take into consideration that 5 to 11s are primary school folks. So we try to accommodate that with later schedules. Some of the other clinics are also trying to get those vaccines into the protocols. I know that Spectrum Health Lakeland is working hard to get that set up for their clinics. There's also some some pharmacies in the area that have prepared the way to be able to give that. So give the places that you have gotten the vaccines before a call, but you can also give us a call, 1-800-815-5485, or go to our website to make those appointments. So yeah, the vaccines are available for that age group, for the health department. But yeah, it's similar to the adult vaccine, though. It does require two doses, so 3 weeks apart. They are packaged differently, so we're not going to make any mistakes about giving a kid the wrong dose. They've been very proactive to make sure that it's clear which vials go for the children, which ones go for the older age group, 12 and up. So I think that's about it.
Thank you. And as you mentioned, Spectrum Health Lakeland is working on our work group currently as we make a plan, and we hope to have some more information to share in the upcoming days. And Dr. Hamel, there are now booster recommendations for all 3 COVID-19 vaccines in the United States for certain populations. Can you share a little bit more about this?
Yeah, I certainly can. The vaccines have all been, of course, studied for boosters. There are some advantages and disadvantages in various age groups. We're recommending that you get a booster with the same vaccine that you had your original series. There's been some conversation, if that's not available, can you mix and match? And the data we're seeing suggests that is certainly permissible. But I think in general, you can get the vaccine that you've had originally. As you know, the French have recently suggested they prefer not to get the Moderna to children because of the slightly increased risk for myocarditis and pericarditis. And so there's some that would suggest that maybe a Pfizer booster or Pfizer series for children would be preferable. I certainly recommend the very safest vaccine that we can recommend. And I believe for the young children, for both primary and booster, the Pfizer is going to be the appropriate vaccine for younger children.
Thank you. Dr. Cabaltica, we are getting ready to head into the holiday season. What are some things our community should keep in mind to ensure they're celebrating safely with their family and friends?
Yeah, that's one of the things we're all looking forward to, that this holiday season, we've actually got the vaccine on board. That'll give us some good protection. So that's, again, if you're having some of the older generations joining you for those celebrations, grandparents, perhaps older parents who have some medical conditions, then certainly trying to get the vaccinations for everyone in the family now going down to 5 years old. But the other things are still, that have been true in the past are still true now. Thankfully, we see that as long as if you can hold celebrations outside, weather permitting, down in southern states, they can do that. Up here, it's going to be a little bit more challenging. If not, then try to see if you can increase ventilation, as much as possible, and monitoring for your own symptoms. If you're having any symptoms, don't just assume, oh, it's just a cold, oh, it's just allergies. Go out and get those tests done. There's plenty of that. There's more and more antigen kits that are available in the pharmacies. So there's capacity for the walk-in clinics to do those tests for symptomatic folks, not asymptomatic. So if you're asymptomatic and worried, go ahead and get those antigen tests. But try to avoid those crowds as well at the malls and in the stores. If you have to be in a crowded situation, do consider wearing that mask still. It's gonna provide some protection for you if you encounter some folks around you who are coughing. I know I kind of make a beeline when someone starts coughing. If they don't have a mask on, I just try to get out of there. So be also cognizant that not everyone is taking those precautions, and where you see, I really don't want to be exposed. Then if you see some folks not taking those precautions, then take it upon yourself to give wide berth there. But again, get tested if you do have symptoms. Consider that those vaccinations; those are going to be our best bet. That the holiday seasons will be as safe as possible for everyone, not only the younger generation, but especially the older generation, who we hope will be able to party and enjoy the holidays with.
Katie, I would like to underscore what Dr. Cabaltica just said. We have seen multiple cases where folks undoubtedly were exposed because somebody had mild symptoms and decided to go out in public. We've also seen folks that have been vaccinated that have done that, assuming that there was no chance that they could spread the infection, and we've had multiple cases linked to those exposures. It's just really important. If you have symptoms at all, stay home until you're tested and test negative. That certainly helps protect your family and your friends and neighbors and your loved one, even if you've been vaccinated.
Thank you. And Dr. Hamel, we know we are entering cold and flu season. How can someone tell the difference between these symptoms and COVID-19, and when should they get tested?
Yes, well, you can't tell the symptoms. In fact, neither can your doctor. I mean, that's the short answer. There are some differences that can be suggestive, but the symptoms from COVID can feel like a sore throat. It can feel like body aches. It can feel like an environmental allergy. It can feel like the flu, and much the same with the flu. We certainly are encouraging everybody to get the flu vaccine. That will decrease the chance that you get a flu. It'll decrease the chance you have symptoms at all, and that you'll need to be tested for those symptoms. The flu vaccine is out and available, of course. We're certainly giving that to everybody at Spectrum Health Lakeland. We would encourage you to take it as well.
Yes. So Dr. Cabaltica, the U.S. Department of Labor issued an emergency temporary standard on November 4th to help protect workers from COVID-19. How does this impact our area employers?
Well, first of all, it affects those who have a total of 100 100 employees or more. So it doesn't affect the smaller business that would find it very challenging to implement this. But under the standard, those who do have 100 or more employees, there's going to be a requirement to go ahead and get vaccinated with one of the accepted vaccines. But there's also there is also a way out for those who really are finding it difficult to adjust to this. That there may be a policy that can be instituted that if you remain unvaccinated for whatever reason, that you'll have to undergo some regular COVID testing and wearing a face mask. So the choice, there needs to be choice, and the ways that this policy has been forwarded, I know it seems very political, but I would say that the underlying motivation is to try to keep our workforce safe. So to do that, that's what's happened. And there are some ways to try to make this as implementable as possible. Again, the size means if you're less than 100, you don't have to implement this. But it is to try to encourage as much uptake of the vaccine as possible. And you've got 30 days after it was promulgated on November 4th to get this started. I know in the skilled nursing facility that I work in, the workers, there's a significant number, they have till December 5th to get their first vaccine. And so it is difficult. There are answers to a lot of the questions and uncertainties. I think, if we can have those conversations, I think that's always the best situation. Go to someone that you trust, someone who is trained in the medical field and knows what the trusted resources are. I know a lot of the divisiveness has come in through Facebook groups that tend to just really polarize and don't take in all of the different viewpoints or sources and studies that are out there that really are trustworthy and really the highest standards of just scientific accountability. So again, if you haven't had your COVID-19 vaccine, this is just another reason to go ahead and get it, to try to protect not only yourself, but especially the places of employment that you go into. There's more information at OSHA on the website for those who are interested in that. So yeah, again, ask for the information. Don't just assume motives behind this, because I think there are good reasons behind it, even though you may disagree how this was implemented.
Thank you both. As always, we appreciate you taking the time this afternoon. I will turn it over to both of you to share any closing thoughts you have with our audience here today.
I'll give Dr. Cabaltica the last word. I just want to thank the community for everything you're doing, for tuning in, for everything you're doing to prevent transmission. This is the way we can help protect the lives of those we care about. I just ask you to assume positive intent from folks that are leaning in and trying to take care of their community, and for the folks that even the vaccine mandate, I know is controversial, but just assume positive intent. We're trying to save lives here, and this pandemic is not over yet. Other countries are seeing very significant surges. New variants are still on the horizon, so hang in there. Thanks so much for what you've done, and thanks for what you will do to help keep our community safe. And by the way, I would just apologize. Two things. One is I didn't intend to be in my car. I don't consider that safe, but I wasn't able to get home to my office quick enough for this meeting. The second is I also apologize for the hairy face. We're doing a fundraiser. And this is No Shave November. Normally I would come to you a little cleaner shaven. But thank you for putting up with those two things.
Yeah, I would just echo Dr. Hamel's encouragement that he and I and everyone in the healthcare field are doing this because we care. We care about our neighbors. That's ultimately what this is about. I know we don't do it perfectly. I know we don't communicate perfectly. And when there are questions that come up, please do ask them. Don't let it go by silently, because I think that's where misunderstandings do happen. We do want to celebrate the holidays. It's the time to be with family, and we're encouraging these measures because we want families to be as safe as possible, because the hospitals are stressed out, but there are better ways now that we have now for these holidays than we had before. So, stay safe and enjoy your families.
Thanks so much.
Thank you. And thank you to everyone who tuned in today. As a reminder, you can get the most updated information on both our Spectrum Health Lakeland and our Berrien County Health Department's Facebook pages, or by going online and visiting spectrumhealthlakeland.org/vaccine and bchdmi.org/COVID-19. Thank you, everyone, and have a great afternoon.